Welcome. Today we're diving into a mysterious heart condition known as cardiac syndrome X. It's a bit of a puzzle, where patients experience chest pain that mimics angina, but standard tests don't reveal any blockages in the major coronary arteries. Join us as we unravel the complexities of this enigmatic syndrome. The exact cause of cardiac syndrome X remains elusive, like many medical mysteries. However, several factors are believed to play a role. These include microvascular dysfunction, where the tiny blood vessels in the heart don't dilate properly. Endothelial dysfunction, affecting the inner lining of blood vessels, is also suspected. Insulin resistance, hormonal imbalances, and even heightened pain sensitivity might contribute to this complex condition. Let's delve into the mechanisms at play. In cardiac syndrome X, the small coronary arteries, the microvasculature, fail to dilate appropriately in response to increased demand. This limits blood flow to the heart muscle, causing ischemia, or lack of oxygen, which triggers chest pain. Abnormalities in the way the heart senses pain signals might also amplify the sensation, making the pain more pronounced. Cardiac syndrome X is more common than you might think, although precise prevalence figures are challenging to determine. It tends to affect women more frequently than men, particularly those in their late 40s and 50s, often around the time of menopause. Individuals with other risk factors, such as high blood pressure, high cholesterol, and diabetes, may also be at a higher risk. The hallmark symptom of cardiac syndrome X angina, like chest pain, typically described as squeezing pressure or tightness in the chest. This pain often occurs during exertion or emotional stress and is relieved by rest or medication. However, some patients may also experience pain at rest. Other symptoms can include shortness of breath, fatigue, and palpitations. Diagnosing cardiac syndrome X can be tricky, as standard tests like angiograms, which visualize the large coronary arteries, appear normal. Diagnosis usually involves a combination of tests, including an electrocardiogram or EKG, to check the heart's electrical activity, stress tests, to evaluate blood flow to the heart during exercise, and coronary reactivity testing, to assess the function of the microvasculature. Newer techniques like cardiac MRI and PT scans are also being used to evaluate the heart's function and blood flow. While cardiac syndrome X isn't typically classified into distinct types, it's important to recognize that the underlying mechanisms can vary from person to person. Some patients may primarily have microvascular dysfunction, while others may have heightened pain sensitivity or endothelial dysfunction. Understanding these individual differences is crucial for tailoring treatment. Treatment for cardiac syndrome X focuses on managing symptoms and improving quality of life. Medications like beta blockers and calcium channel blockers can help control chest pain. Nitrates may also be prescribed to dilate blood vessels. Lifestyle modifications, such as regular exercise, a heart-healthy diet, and stress management techniques are essential. In some cases, medications that improve endothelial function or address insulin resistance may be considered. While completely preventing cardiac syndrome X may not be possible, adopting a heart-healthy lifestyle can significantly reduce your risk. This includes maintaining a healthy weight, eating a balanced diet low in saturated and trans fats, engaging in regular physical activity, managing stress effectively, and avoiding smoking. Controlling blood pressure, cholesterol, and blood sugar levels is also crucial. The prognosis for patients with cardiac syndrome X is generally good. While the chest pain can be debilitating, the condition doesn't usually lead to heart attack or sudden death. However, it's important to manage symptoms effectively and address underlying risk factors to improve quality of life. Recent research is focused on developing more targeted therapies that address the specific mechanisms contributing to the condition, such as microvascular dysfunction and heightened pain sensitivity.